My name is Christopher Schneider. I'm the Adaptive Radiation Therapy Technical Director here at Mary Bird Perkins Cancer Center, and I'm an adjunct assistant professor of physics at LSU. I've been interested in physics ever since I was a kid. My dad used to take me to the planetarium and the science museum, and always been fascinated by how things work, so it felt like what I wanted to study when I was old enough to choose. But then I started thinking about what I wanted to do with my life and how I wanted to use that interest and apply it to help people and to give back to the community. And medical physics seemed like the perfect combination of my natural interests and ability to serve the greater good. We had a patient that we treated on the Unity, the MR-Linac in our adaptive program, who was a deacon from New Orleans. Just a great guy, one of the nicest guys I've ever met, and actually an old family friend. He had a rare condition where as a child he had part of his rectum removed so that he had what's called an iliac pouch. And it's well documented in the literature that this is very sensitive to radiation. And so he was not able to be treated until he was referred to us so that we could treat him with the MR-Linac. That enabled us to see this pouch really well and track it during treatment so that we were very confident that it was never in the field and that the doses that we're receiving were low. And he's doing great, so that really meant a lot. That was a case of a patient who really wouldn't have been able to be treated otherwise without the technology that we have here in the adaptive program. We know that the adaptive program, we really want to make sure that we give patients peace of mind. So what I tell patients who come in to be treated on the Unity is that the MRI-Linac, it's a combination of an MRI scanner and a radiation therapy treatment machine. We're taking high-quality MRI images of the patient every day, immediately prior to treatment. That means compared to other forms of radiation therapy, we receive the highest possible quality images so that we can see the tumor better. That allows us to target it more precisely. It also allows us to see the healthy tissues around the tumor so that we can minimize the risk of side effects. And it allows us to track the tumor while we're treating so that if a patient has to cough or sneeze in the middle of treatment, even just for a second, that beam will pause immediately and we will not deliver any stray radiation to places where it's not meant to go. So they can just relax and know that their physician and their entire care team is right outside the door monitoring their treatment the entire time. As an institution, our partnership with Elekta, what we've been able to do with the adaptive program has been revolutionary.